Okay, so today we have got our lovely patient Kathy here who had a skin lesion which has been checked by NHS hospital and was confirmed that it's a benign lesion. She then decided to have it removed at a place, at a non-medical place, which they used freezing for the lesion, and basically nothing has happened. It is important to know that although a lesion could be confirmed as benign, you can't attempt going to non-medical places for removing by freezing. Kathy is going to explain to you what has been involved, and Dr. Glancy, our cosmetic surgeon who's going to do the procedure, she's going to explain of what is going to happen. Kathy, would you mind explaining in your own word what was going on and what happened?
Well, I've had this since I was very young, and it's got bigger and bigger over the years. And lately I just realised every time I look at a photograph, all I can see is this. I don't see anything else. And then I decided to try the NHS yet again after years of asking, can they get rid of it? And they said, no, it's cosmetic. We won't touch it. And so then I looked up some places that would get rid of moles and things. I got it looked at, and somebody said they could freeze it, froze it, scabbed over, a scab fell off, that was still there. Went back for more treatment, same thing happened, and it really hasn't changed at all. So that's why I'm here.
Yes. Okay, so clearly what's happened here is that just a very superficial destruction of the tissues. It maybe have gone a little bit smaller. I don't know, because obviously I haven't seen the lesion originally, but that's not enough, because this lesion is quite prominent, and although to the naked eye it does look benign, it's been checked, and 99.9% is benign, with the naked eye we can never be absolutely sure. Therefore, when we remove lesions, we always send them for histology to be absolutely sure that there's no malignant changes, there's nothing else there. So what we're going to do a procedure called excision biopsy, where we're going to remove the lesion entirely and put it in a histology plot, send it to the lab for analysis, and there will be a couple of stitches there, and there will be a tiny little scar which will be just above the eyebrow, probably blend with the top of the eyebrow, and because of the hair of the eyebrow probably be quite well hidden, but this is the correct way of removing this lesion, to make sure that there's nothing sinister as well at the same time.
Mm-hmm. Can I just add on something? That we check the skin lesions with dermoscope. Mm-hmm. So basically we use a skin microscope for checking the skin lesions. Someone who checks the skin lesions with a skin microscope or dermoscope has to be trained and have experience in the field. And I always say that in the eyes of most expert dermoscopists or even dermatologists, things, as you said, can get missed out. Hence the reason lesions get cut off and go for pathology. Because patients need to have the reassurance that, God forbid, 10 years down the line, if something is appearing somewhere in their body, they go back and they think, hang on a minute, that lesion which has been removed, was it really benign, or was it the culprit behind everything which is happening? That's why you are taking it, you're putting it in a pot, and we are sending it for pathology. Once for good, the mind of the patient is going to be clear about what has happened. Thank you.